I'm Dr. Meghan McGovern with Coastal Empire Plastic Surgery. Today I'm here to talk with Donna, and Donna has been coming to me for almost a decade. So we've been doing things over the years and keeping her looking gorgeous, because she was gorgeous when I met her, but she wanted to maintain and she wanted to enhance her beauty. So we've been doing things over time and keeping it looking very natural and looking really real. So Donna, tell us a little bit about yourself.
Okay, I'm 47 years old. I have two children, a 25-year-old and a 13-year-old. I'm an esthetician, and that's a skincare specialist. I went to school in 2006 to become an esthetician, exactly a year after I met you. And my goal was to work with you and what you do. I was so impressed by everything that you encompass and you stand for. So I wanted to work with you.
So we've been together for a long time now, but you didn't work here and you weren't an esthetician when we got started with all this stuff. So in the beginning we started working on the brows because that was something that really bugged you. So we actually did a brow pexy, and we've done some Botox and things to get things nice and smooth for you up there. And we've done filler, and we've done skin treatments, and we've done Ulthera. We've done just about everything over the years. And I think that's the most powerful thing about your story, and part of why we're talking today is because we've been doing this for a decade, and you started out gorgeous. You're even more gorgeous now, and the goal is to keep it real and keep it natural looking and go about it from that standpoint. Here is a picture of you back in 2005 when we first met, and a picture at the end of 2012. So it's almost 8 years apart. And frankly, you look younger in the second picture than you do in the first picture. But you look like you. You look gorgeous, and that's the beauty of that picture, is that we've been able to maintain and enhance and keep you looking normal and human and all those things, and even more fabulous than when we started.
That was definitely what I was most impressed with when I came to you. I had Botox in the past before my first visit with you, and it was not a good look. And
well, tell me what you didn't like about it.
Well, my first experience with Botox, it dropped my brow. I had some pretty deep vertical lines on the forehead. When they gave me Botox, it dropped my brows and made my lid droop. When I came to you, you said you need a brow pexy.
The way I do a brow pexy is it's still a minimally invasive procedure, but with less downtime than a formal brow lift. But it's a suture suspension of the tail of the brow where we help elevate the tissues. I always warn patients that they're going to look a little overcorrected for a few weeks afterwards, but then it settles down. So that's actually a procedure where we make incisions and that kind of stuff. The rest of what we've done to your face has all been non-surgical. It's all been taking good care of the skin with good skincare products, restoring volume and lifting with fillers, and tightening with Ulthera. So all of the other stuff that we've done to your face has been non-surgical, and maintaining with that. How do you think all of this has affected you, and how has it affected your family and friends?
Obviously I think it's been a wonderful thing. I get asked on a daily basis, what do I do? What skincare do I use? Who does my injectables? How do I look better today than I did 8 years ago? Yeah. And I do agree. I do agree when I look at the pictures that I look better now than I did then, which is amazing to me. I don't look overfilled. Yeah. I still have movement of my face and of my eyelids and of my brows, and I can still smile and make expressions, and my family still knows when I'm mad. But I agree that I look better than I did then, and it's all been an experience that been a path that I love, absolutely love, and ultimately decided to go into myself, and I'm still learning every day, and that's what I love about it. I see so many patients who have been to other doctors who we talk about this. They look like a chipmunk. They put all of their fillers in the same place or in the nasolabial folds where they look like they're storing nuts. And I'm asked on a daily basis, you don't look like you've had filler. And that's what I think is so great about the technique that you use, where you restore the volume, is you cannot tell that I've had filler. because you restore it up here where I had lost volume and become a little concave here on the temples, and I think that that's brilliant, and it's worked perfect for me, and it makes the biggest difference in the symmetry of my face.
Right. Going back to the pictures, the before and after pictures of you from 2005 to 2012, one of the other things that's really striking to me is the difference in your nose. And I think it's important to point out that that is the only part of your face that I have never touched. Your nose is the same. It's by creating better facial harmony and better balance to your face and restoring volume where you needed it, that your nose disappears. Your nose becomes more balanced with the rest of your face, and it doesn't look as prominent. So we didn't do anything to your nose, but yet the overall facial harmony is so much better. We've been talking about how it's time to do some filler on you, and now that Juvederm has come out with Voluma, we're going to do that this time because it's going to last a little bit longer than the ones we've done before, and so we'll be doing that soon.
I'm excited. Thank you.
My pleasure.
Thanks for everything.
Contact Dr. Meghan McGovern at Coastal Empire Plastic Surgery today to learn more.